Health assessment, assessing health status. Assessment is a vital part of nursing care and is performed on an almost continual basis. The initial detailed assessment will be done on admission, and it includes a physical examination, history and demographic data, information that's pertinent to their daily care, current health problems, and focused assessment on every successive shift. Nurses must be aware of how the illness is affecting the client's life, not only their health, but in all other areas. Assess for cultural preferences and health beliefs. Cultural assessment is mainly a matter of asking the client and family about their preferences for food, bathing, and personal care, what they think about their illness and treatment, and who should be consulted about decisions. Don't assume that just because a person is a member of a certain ethnic group, that he or she has beliefs and practices that are common to that group. Phrase questions in a positive, non-threatening way. The initial or admission assessment should include an interview to determine social data, marital status, occupation, visual or hearing deficits. Do they have dentures or any prostheses? Do they have allergies to foods, drugs, or other things, environmental, such as pollens? And what medications do they take, including over-the-counter and herbal supplements? What is their normal diet? Do they have any limitations or allergies, or do they have a need for or eat any special foods? Are they smokers? Do they use alcohol? How do they complete their activities of daily living? Have they had previous surgeries? What are their health problems, current and past? What is the reason that they were admitted? Note the client's level of physical fitness and independence. So you're watching them walk into the room, you're looking at how they sit, etc. With the physical data, we'll be looking at the head and neck, the chest, heart, and lungs, the abdomen, the genitourinary system, extremities and musculoskeletal system, and the endocrine system. The physical assessment is going to provide a complete picture of the physiological functioning. The nurse has to recognize cues. The client may not feel certain information is important. They may not remember to provide certain information, or they may not realize information is pertinent to his or her condition. Comprehensive information and in-depth information will include all systems of the body. We also will do a brief assessment, which is kind of the scanning type of examination, and usually will be confined to a specific body part or system. Information that's gathered from the physical assessment can then be used to determine the client's level of health and physiologic functioning, arriving at a preliminary nursing diagnosis of a health problem, confirming a diagnosis of dysfunction, disease, or inability to carry out activities of daily living, also known as our ADLs, indicating specific body areas or systems that need additional testing or examination, evaluating the effectiveness of prescribed treatment and therapy, and observing for side effects, monitoring for changes in body function, determining whether there's any signs of abuse. And remember that physical examination can be completed by a physician, a nurse, a physician assistant, a nurse practitioner, a clinical nurse specialist, or other clinician, all depending on the client's need. So with inspection and observation, during every contact with a client, the nurse is going to be visually inspecting and observing the client. What are their behaviors? What is their gait? Look at their skin, their respiratory effort, their posture, their facial affect, etc. All of this is going to provide clues to potential issues the client may or may not verbalize or even be aware of. Inspect visually the various parts of the body and the behavioral responses of clients. What's their general appearance, the contours of their body, their skin tone and color? Do you see rashes, scars, or lesions? And are there any deformities or extremity weakness? Make certain that you always ask the client for permission before touching for a physical examination. Palpation uses the hands and fingertips to touch and feel various parts of the body. It's used to ascertain the size and shape and position of body parts, the texture, temperature, and moisture of the skin, presence of muscle spasms or rigidity, pain, tenderness, or swelling, presence of a growth, restriction in body part movement, skin temperature and turgor, and presence of edema. The important thing to remember is if, as a nurse, we cause pain, we need to stop our palpation. Percussion is not a technique that's utilized by LPNs, but we're going to briefly discuss it so you at least know what we're talking about. It is another method of obtaining information about body structures. It involves a light, quick tapping on the body surface to produce different sounds. Variations in the sounds will reflect characteristics of organs or structures below the surface. It helps in determining the size of organs, location of organs, the density of organs, and the presence of air or fluids in the tissue or in a body cavity. It's used primarily over the chest and abdomen to determine the size, location, and density of the organs that lie inside. The most common type of percussion will consist of striking the middle finger of one hand with the middle or index finger of the other hand. Force will then be generated with a quick snap of the wrist. You don't use the forearm, just the wrist. And they listen for sounds varying in intensity, pitch, and duration. Auscultation involves listening to the presence or absence of body sounds using a stethoscope. It's particularly useful for listening to lung sounds. And make sure you use the diaphragm for all lobes, the diaphragm of the stethoscope. The heart sounds will use the diaphragm of the stethoscope for the normal S1, S2, and to count the heart rate. We also will use the bell for some abnormal heart sounds. We auscultate the abdomen to listen for bowel sounds. To use the stethoscope, make sure that you place the earpieces in your ears so that they point forward toward the nose. And olfaction. This uses the nose to identify odors characteristic of certain problems, such as breath odor for sweetness, acetone, or alcohol, wound odors, odors from discharges, such as vaginal infections. Other odors can be used to identify specific problems or conditions, such as a fruity odor to the breath. This will indicate diabetic acidosis. Alcohol on the breath can provide a clue to the client's lethargy or irrationality. A foul mouth odor can indicate periodontal disease or poor oral hygiene. A foul or sweet odor coming from under a cast or a wound will indicate infection. And a foul odor in the female genital area can indicate a vaginal infection. So let's talk about basic physical examination. When we do the height and weight, we normally do this without shoes. If it's an infant, we do this without a diaper. And make sure that you never leave an infant unattended. When you lay them on the scale, your hands should hover over the top of them, so if they decide to wiggle or roll, they don't roll off of the scale. The adult weight will usually be obtained with a standing scale, but can also be obtained from a bed scale or a chair scale. Height will be measured from the sole of the foot to the crown of the head. Vital sign measurement will compare previous measurements with the current results. We're looking for trends. So is the temperature going up, down? Is it staying the same, etc.? The blood pressure should be measured on both arms after the client has been sitting or lying quietly for at least 5 minutes. It is most accurate if the client's feet are flat on the floor, the brachial artery is at the level of the right atrium, and the client and nurse don't talk. Don't obtain on an arm where there is a dialysis shunt, an IV site, or on a side where there's been a mastectomy and lymph node dissection. If the blood pressure is elevated, wait about 15 minutes and retake it to see if it begins to normalize. The pulse will usually be assessed at the radial artery. Make sure you use the fingers and not the thumb. Using the thumb, you may actually be getting your pulse rate instead of the client's. If it's irregular, assess the apical pulse for a full minute. The apical pulse is monitored for a full minute with specific medications such as digitalis or beta blockers. Respirations are usually counted with the fingers still on the radial pulse because that respiratory rate might be altered if the client is aware that the nurse is counting them. And if the respiratory rate is irregular, count for a full minute. And then we get the temperature, oxygen saturation, and pain level. When we review the body systems in a full physical assessment, we're looking at the head, neck, chest, heart, and lungs, the skin and extremities, the abdomen, the genitalia, anus, and rectum. A systematic way to perform an assessment is where we develop a system to perform the assessment so you don't forget anything. In other words, we want to make sure that we have a routine way of doing an assessment so we're not leaving out listening to the heart or obtaining cap refill, etc. So system, and everyone's system is going to be slightly different from another. We also want to assess rest and activity, nutrition, fluids and electrolytes, safety and security, hygiene, oxygenation, psychosocial and learning, elimination. Assessment of clients will involve the interviewing and gathering of a history, performing the physical examination, or assisting the healthcare provider while the physical examination is performed. In many instances, a nursing assessment of the areas of basic need might be more appropriate than a total physical assessment. Always assess the client with every client contact. For example, we're going to assess their orientation with all communication. We assess for pain by watching their face and body language. We assess their body language and facial expressions for changes in assessment. When rolling for linen changes or pericare, we're going to assess their back and their heels for skin impairment. When assisting them to the bathroom, assess their back and their sacrum. When bathing, always assess their skin. We're going to do shift assessments. This is usually going to be a quick head-to-toe assessment, and this helps establish priorities of care. Again, use that systematic approach. For example, let's start at the head. We're going to check orientation, vital signs, including the pain level. We'll do the heart, lung, and bowel sounds all at the same time. Pulses, cap refill bilaterally, edema, etc. Then we'll look at those extraneous items such as wounds or dressings with exudate, IV sites with fluid assessments and the IV system assessment, drains, their oxygen, what's the flow rate and delivery method, is humidification used? And humidification is a must with pediatric clients, or if we're delivering 4 liters or higher of oxygen. We're also assessing if they're in traction, braces or casts, etc. A focused assessment will be just a brief examination, and it will occur when a complete head-to-toe assessment isn't needed. This will include neurochecks after a head injury. Maybe we're monitoring the cardiovascular system, the respiratory system, or the gastrointestinal system. If they're complaining of abdominal pain, we'll focus on the belly. If they're complaining of shortness of breath, we're going to check the respiratory and cardiovascular system, etc. When we assess the basic needs, there is a mnemonic that we can use. It's called RN's HOPE. It stands for rest and activity, nutrition, fluids and electrolytes, safety and security, hygiene, oxygenation, psychosocial and learning, and elimination. Patient education topics can include the need for regular physical examinations, recommended periodic diagnostic tests, the need for immunizations, the necessity of regular dental examinations, the warning signs of cancer, when to notify their primary care provider, for just a few. A good time to provide client education about preventive health is going to be while you're doing your assessment. When you assist with a physical examination, we need to make certain that the client is in the appropriate position and they're adequately draped. Most examinations will begin with a client seated on the end of the examination table with a drape over their lap and legs. The client will assume the supine position, and the drape is then pulled up over the upper body so the chest and/or abdomen can be exposed. There's a variety of positions that may be necessary. The lithotomy position is the one that is on your slide, the knee-chest position, the lateral or Sims position, and the prone position. Prone meaning they're lying face down. Supine would mean they're lying on their back. The primary purpose of draping the client is to prevent unnecessary exposure of the body during the examination. A client that feels exposed and embarrassed is going to be tense, restless, and less able to cooperate. Elements of the physical examination: make certain as the nurse that the client has emptied their bladder. Ask them to disrobe and put on an examination gown if that's required. Prepare the exam table. Make certain necessary equipment for the physical examination is ready. Different examinations may include a pelvic exam and a pap smear, a rectal examination of the prostate, body systems, the interior of the eye, the ears. Remember that a female nurse must be present in the room anytime a male healthcare provider performs a pelvic or breast exam. This protects not only the client, but also the healthcare provider. Common procedures that the nurse may be asked to perform might be a urine dip, a hemoglobin measurement, a random blood sugar measurement, an electrocardiogram, and possibly a spirometry reading. Evaluating the techniques of a physical examination and the thoroughness of data collection is an individual responsibility. Questions to ask are: were all the areas assessed adequately? Were any pieces of data missing from the assessment form? Excuse me. Was the patient comfortable during the assessment? Did the interaction remain focused on the assessment? Was all equipment available for the examination? Was the client positioned and draped appropriately? And were procedures and their purpose explained to the client? So, question: A systematic way to perform an assessment is to use the acronym RN's HOPE. Which letter is correctly defined? That's going to be number 2. Remember, RN's HOPE stands for rest and activity, nutrition, including fluids and electrolytes, safety and security, hygiene and grooming, oxygenation and circulation needs, psychosocial learning, and elimination.